Now let's discuss quetiapine as a different drug at different doses. The antipsychotic quetiapine is an 800 papa bear, ideally in the XR formulation. The antidepressant quetiapine is a 300 mg mama bear, also ideally in the XR formulation. And the sedative hypnotic quetiapine is a 50 mg baby bear, ideally in the IR formulation. The baby bear in IR formulation blocks almost all H1 receptors within minutes of oral administration, and then rapidly declines in terms of H1 occupancy, diminishing the chances of a hangover. But the baby bear doses are not approved as hypnotics. Plus, this can be an expensive option with metabolic risks, so it is not considered a first-line option for sleep. And with XR formulation, this peak is not reached until it is time to wake up. Now, the mama bear is the surprise bear in many ways, anecdotally observed to have antidepressant effects in bipolar as well as unipolar depressed patients in the 300 mg range. This can be contributed to its active metabolite norquetiapine, which has norepinephrine reuptake blocking and 5-HT2C antagonistic properties much greater than the parent quetiapine itself. Two mechanisms can individually increase the release of both dopamine and norepinephrine, and together appear to have a synergistic action at doses below those that cause 60% of D2 occupancy. In addition to this, quetiapine also has 5-HT1A partial agonist as well as 5-HT1BD7 and alpha-2 antagonistic properties, also theoretically linked to antidepressant actions. As XR formulation has a consistent day-long receptor occupancy, it is preferred formulation for the treatment of depression. Quetiapine is approved both for bipolar depression and as an augmenting agent to SSRIs and SNRIs in unipolar depression that fails to respond sufficiently to monotherapy, simultaneously treating symptoms of insomnia and anxiety by antihistaminic actions. Finally, coming to the 800 mg papa bear. It completely saturates both H1 and 5-HT2A receptors continuously in both cases, but has a more consistent occupancy above 60% of D2 receptors with XR formulation. No matter what dose or formulation, quetiapine is very atypical in that it causes virtually no EPS at any dose, nor prolactin elevations. Thus, quetiapine tends to be the preferred atypical antipsychotic for patients with Parkinson's disease who require treatment for psychosis, as is clozapine, but can cause weight gain, particularly when given in moderate to high doses, as it blocks H1 receptors and increases fasting triglyceride levels as well as can cause insulin resistance.